But in reality, oftentimes what happens, implementing a new technology or piece of software in a healthcare organization is like doing surgery with a blunt force instrument like a sledgehammer. Let's face it, healthcare technology is supposed to make life easier, right? You're going to get better patient engagement, improved workflows, more efficiency, improved clinical outcomes, staff and employee retention and all that kind of stuff. But in reality, oftentimes what happens, implementing a new technology or piece of software in a healthcare organization is like doing surgery with a blunt force instrument like a sledgehammer, right? You're pounding away at stuff. It's getting messy. It's not what you signed up for, right? So what I wanted to do was go over the 5 biggest mistakes healthcare organizations make when they're implementing a new piece of technology and how you can avoid them if you happen to be in the position of trying to determine which tool or technology you're going to bring into the practice, or maybe you're staring down the barrel of deploying a new piece of software in the clinic now or in your organization or your department. How can you avoid the 5 most common mistakes? Mistake number 1, and this is not as common in larger healthcare organizations where you have more of a defined selection and procurement process for like a vendor, but oftentimes, especially in the private healthcare space, which is the target of a lot of marketing and sales efforts for healthcare technology startups, what ends up happening is oftentimes owners, practice managers, you name it, can end up falling for shiny object syndrome, right? Maybe the rep came in and did a demo for your team and it just looks awesome, right? It looks super slick. It promises to, revolutionize the way you do X, Y, and Z, the way you provide care, the way you process payments, whatever it is. It's going to cut your admin time in half. It has all these promises, right? It'll be sunshine and unicorns and rainbows and all that if you implement our tool. And suddenly, you're ready to make a buying decision, sign on the dotted line without asking the big question, which is what you actually should be asking. I've mentioned this before. Whenever you're considering a new piece of technology, a new piece of software, a new digital tool or solution, does this tool, technology, software, does it advance the strategic goals of the organization? And if the answer is no, or you can't clearly communicate, or you can't clearly tell a team member or other stakeholders, this piece of software will solve this problem, which is limiting us or preventing us from reaching this strategic goal, then you really need to take a step back and really reconsider whether or not you need to implement that tool in the first place, right? Again, it all comes down to aligning the potential that healthcare technology has, the potential to really become a force multiplier, individualized patient care, whatever it is, with the strategic and operational goals of the organization. And sometimes things that might really provide value in some instances or to some clients or to some clinics won't necessarily do that for your clinic because your clinic has different priorities, right? So you need to make sure that you're not following shiny object syndrome, that you're actually taking a strategic approach. Sounds super cliche, but that's what you want to do. You want to look at the mission and the strategic tactics that you've laid out for this quarter, this month, this year, maybe 3 years down the line. That's how the timeline you want to look at. And how does this piece of technology fit into that larger vision? And if it doesn't, then you really need to reconsider it altogether. So mistake number 1, shiny object syndrome. Mistake number 2 kind of falls in line with that, but not having a clear why behind it, right? So this happens when leaders, maybe a practice owner or something like that, decides to roll out a new piece of software and they tell their team, we picked this piece of software, here's how to use it, or go use it. But they don't take the time to clearly communicate the why behind it to their team. I mentioned this on the podcast before. I mentioned this on different videos. This is after you've identified how this piece of software or this technology or this tool aligns with your strategic vision and the mission and the purpose of the organization, the next step is to communicate that very clearly to the team members that are going to be in charge of employing it or deploying it in the clinic or in the admin side, right? People, for the most part, are not motivated by technology. I mean, yeah, everybody likes to get a new whiz-bang thing. Well, most people do. I've got some teammates at the clinic that I run that don't want anything to do with new technology at all. They're just happy using what they've got, right? But people, for the most part, even if they're innovative and they want to be pushing the bounds and being on the cutting edge, they're not motivated simply by the technology. They're motivated by really the ultimate purpose, which in this case might be, quality patient care or something like that. And if you can't connect the dots for a team member of this tool helps you deliver better care to this patient because of XYZ, they're not going to be super on board with it. So clarity of purpose can turn reluctant users or people who might be skeptical even of a new software or of a new tool or platform into real champions of the tool or of the initiative. If they see a clear connection between the mission and the vision and the purpose of the organization and how this tool fits into that, it's golden. Mistake number 3 is not taking into consideration or ignoring even frontline staff during that selection, that implementation process, right? I've seen this a few different times at organizations, all the way back in like 2013 when I was at the VA and they decided to roll out, they were digital patient kiosk systems at every clinic. Their goal was to basically eliminate clerical staff or staff that was checking patients in, and they implemented these like clunky, this is obviously 12 years ago, so the tech was not nearly as good as it is now, like these poorly calibrated touch screens where you had to like punch it as hard as you could with your finger, and they implemented this, but they basically didn't tell anybody. One day we were treating in the clinic, and somebody rolled in with a couple of these kiosks on like dollies, and they just started setting them up in the waiting room. We were like, what's going on? They said, oh yeah, this is the new check-in the system for your patients, for your clinic. We were like, well, no one really told us how to use this, right? Or what's going on. So if you don't involve the people that are going to be using that technology or that software day to day, every day as part of their jobs, you're going to get a lot of pushback. You're going to get a lot, sometimes turnover in the fact that the team will just say, you know what, I'm going to go find another job where they're not springing this kind of stuff on us, or I like the way it was before. So your clinicians, maybe they're nurses, maybe they're doctors, maybe they're therapists, and your admin teams are the ones who will really make or break the system for you. Because if they decide not to use it, or they're clunky to use it, or they, give you a lot of pushback, you're not going to achieve the outcomes that you're hoping to achieve by implementing this tool. You're not going to receive the benefits. So you need to make sure that you're taking that into account and involving them, again, from the beginning of that decision-making process, tying it back to this greater, larger purpose of the organization and communicating clearly to them why this is important. Again, clarity in communication is probably one of the most important things as a healthcare leader that you can do for your team, providing some context and understanding behind any decision that gets made to the organization, and technology being now one of the big ones, because there's always a new piece of software, a new tool, or a new platform that's vying for attention among a lot of healthcare organizations, right? Mistake number 4 is underestimating the learning curve. Okay, so even if it is a simple to use product or seemingly simple to use product, there's 2 pieces here that are hugely important. One, the actual learning curve of the software, the platform, the tool, whatever. How do you actually use it, right? Because even though it might be very intuitive to you, the decision maker, or you, the management team, it might not make sense for the clinic or the clinician or the frontline staff who's going to be using it. Maybe they're used to a different interface or different operating system, or just a different UX. Like they're just different. They're used to a different, even visual display of what's going on, right? So, and that can be a challenge. So you want to make sure that you're not underestimating how long that's going to take, the amount of effort that you're going to need to put into training, into onboarding. You can't just flip a switch a lot of times and expect everybody to be experts in this. Even if it's a really, really simple tool, there's all little kind of nuances that no one really thinks about. For example, it might be something as simple as like, how do I access, the case notes or something like that? Or how do I access this piece of data that was on this button in the old system? It was it was on a tab. It was very easy to see, and now I don't even see it. How do I navigate it to it? Little things like that. So training needs to be simple. Obviously, you want to make it as clear as possible, but it needs to be ongoing, kind of before the rollout, during the rollout, and then after the rollout. And you want to make sure that if you can, that you put together maybe a committee or a team, or even just one like person that can be your super user, your power user, that becomes an expert in this and that can be the resource for their team members as questions start popping up about implementing, how do I access this feature? Or how do I do this? Or, how do I find this piece of information? You want to make sure that you're decreasing the friction of implementing the new tool, but you also want to make sure that you're setting the team up for success at the beginning, before you even implement the product or the software or the tool, by providing as much information as you can before. Maybe it's how-to videos, maybe it's demos, maybe it's live interactions where they can get into like a sandbox or a dummy account and mess around and play and kind of explore the system or the software, so that they have a little bit more of a confidence in navigating the system before like a patient is sitting in front of them, and then they're trying to figure out, well, how do I do XYZ? No one wants to be figuring that stuff out on the fly. Help your clinicians by a robust training program or training plan that involves pre, during, and post rollout of this tool. And then mistake number 5 is not identifying what the key metrics for success would be, but then not tracking them, right? If you're not measuring it, it's not going to get managed. If you don't manage it, it's not going to get improved, right? So this one's a large one for people like me who are like, I like making decisions based off of data and metrics. And you can't improve what you don't measure, right? So whether you're rolling out a telehealth platform or remote therapeutic monitoring platform, or even new scheduling platforms or something like that, you need to know, one, is it improving patient experience, patient engagement, and what is the number or metric I'm going to use to gauge that? 2, has it made the workflows more efficient? And corresponding, what number am I going to use to gauge that? Is it going to be time to closed referral? Is it going to be time to schedule? Is it going to be wait times on a call center, for example, or something like that? Are the clinical outcomes better? And then again, you want to be able to identify like, what are the 3 outcome measures or the main outcome measures that we're going to use on a clinical side to show that there are real clinically significant improvements in our patient population since implementing this tool, right? You want to track the data, you want to measure it, and then you want to have frequent communication about that. I would almost say before you roll the software, the platform, or the tool out in the first place, say, listen, again, we've brought you in at the beginning to kind of explain why this change is happening, or why we're considering a platform. These are the things we've talked about. You've provided input, hopefully, on how to make some of the make it easier to implement the tool or the technology. Because the main goal, the strategic goal for the organization is to decrease wait times for patients in the waiting room or something like that. This is the number we're tracking, the time they check in to the time they get seen by a clinician. And we'll start tracking that before we even roll out the software, so that we have a baseline, right? We could talk about brainstorming in staff meetings and team meetings. What can we do to kind of improve it? And then once you start rolling out the software, begin tracking it and then meeting about it regularly. Every week we're talking about, okay, the wait time was 5 minutes, now it's 4 minutes and 30 seconds, now it's 4 minutes and 20 seconds, whatever it is. Celebrate the achievements as they come, but then show the team that that there's accountability, that you're tracking this metric. It's not just in the ether or just subjective, that there's a hard number that you're looking at that's going to show and demonstrate success, and that's what you're looking for as an organization. And it gets the whole team clarity about what's the goal here, what are we trying to achieve by implementing this technology. So anyways, there you have it. Those are the 5 biggest mistakes that healthcare organizations make when they're implementing a new piece of technology or software, and a couple strategies you can use to try to avoid them. If you can steer clear of those 5 big pitfalls, you have a much higher success rate or chance of making the technology that you're implementing in the clinic work for the organization and not become something that's like a problem or working against the organization at the end of the day, right? Because at the end of the day, the goal isn't to add more software or to get whiz-bang marketing promotion materials out of this new tool that we're using. It's to deliver better care, right? It's all about people, the people that are delivering the care in your organization and the people that are receiving the care. And as long as you're keeping those 2 things in mind as you select and implement and roll out new technology, a new tool, you'll be in a much better place to actually, realize the benefits that are possible with healthcare technology.